Thank you. I would like to thank the speakers and moderators for this session. Now there is a lot of debate as to where should I settle. Is it always the urban area which is good or rural area also now better becoming better? For this debate, may I call upon the stage the moderators for this session, Dr. Sanjay Kulkarni sir and Dr. Sanjay Deshpande.
Once again, good morning, everybody. We'll start with the first.
Talk by Pankaj, who man, beautiful.
Mike.
Uh, who, from what I gathered, in the last minute, he changed his mind from settling in Akola to Mumbai. Let us listen to his journey.
Thank you, sir. First and foremost, I thank Dr. Vijay, Dr. Sabnis, sir, for this kind invitation. I sincerely thank the West Zone for giving me probably the easiest debate I have ever faced. I can just finish by saying that urology is not a rural branch. Urology is a urban branch, and you cannot do urology practice in rural settings. Leave alone rural, even for a small city setup, urology practice may be a difficult. To take this point further, I would change this topic a bit, giving my side of story, which is millstones to milestone, and why not should we move from millstones to milestone. For people who do not know what millstone is, these are two large circular stones which are used to grind the grain. My great grandfather worked as a millstone worker in a small village in Rajasthan. From Rajasthan to move away from the grinds of poverty, my grandfather moved to a small village in Maharashtra. Interestingly, the name of that village is called Roti. In Roti village, it is in Nandura district. There are not more than around 50 houses. My father, the youngest among the five siblings, realized that the only way to progress was to study. He decided to go to medical school. Obviously, my grandfather could not support his education. He studied in hostel. And even the food that he ate, one of his friend, Dr. Mehra, who is practicing in Chandrapur, he was doing dieting. So one of his one-time tiffin was used by my father. So coming from this background, for us, childhood compared to him was a birth with a silver spoon in mouth. Obviously, we had to study. Went forward, did my MCH urology, went to Mumbai. Once I finished Mumbai, I had that romantic dream that okay, I should come back and serve the real India, and we know real India is rural India. Maybe someday I could write a book on rural surgery to say how practice should be done in rural India. So I went to three of my important peoples in my life to get advice. First and foremost, obviously my father. I asked him, what do I do? This is what I want to do. There are two, three things he told me. Number one, he said, okay, you want to come to Akola? Very good. I have a hospital. Join my practice. But forget that you are a urologist. You'll have to do hernia, hydrocele, appendix, everything. Maybe also malaria. And do TRP with that if you are still have time and energy. And he said, in 1992, मेरे अस्पताल में आ जाओ मैं 5 लाख रुपए महीना तुमको देता हूँ उस वक्त 5 लाख बहुत बड़ा अमाउंट था Further, to take precaution that I don't settle in Akola, he sold off his practice and retired at a very young age. He never wanted me to come to Akola. Next, I went to two more people. I have never been Dr. Ajit Farke's student, but one day I just called him up, sir, I need your advice. I was called to his clinic at 7:15 in the morning. For nearly 1 hour, he sat with me, took a detailed family history, personal history, and what my milestones in life are. And when he came to know that my interests are in teaching, probably publications, getting known in urology society, not necessarily known in general public society, he said, no, you have to settle in Mumbai. Dr. Manmohan Daga is one of the first super specialists in central India. He was like my godfather when I was doing MBBS in Nagpur. I called up sir, sir क्या करना चाहिए? He said अगर अच्छी comfortable life चाहिए तो अकोला जाओ. सेंट्रल इंडिया में जाने जाना चाहते हो तो नागपुर आ जाओ. पर अगर थोड़ा भी कोई इंटरनेशनल आपका एस्पिरेशन है तो यू हैव टू गो टू मुंबई. All this says that if you have big dreams of developing yourself in urology, rural practice or small place practice is not the way to go. When we joined urology way back in 92, people took urology because urology was a very easy branch to settle. You needed a small hospital, you needed a TRP set, 5 lakh rupees investment, you can practice wherever you want. But today, urologist is no longer an island. I need good operation theatres, equipments, pathology, radiology. Tell me, other than hydrocele, what is the thing which we can diagnose clinically? And today we don't want to treat hydrocele, that is treated by general surgeons. So nothing in urology happens without proper investigation. I also need connectivity to attend conferences. I need good internet connectivity. My kids need to go to good school. If I am a rural person and if my daughter needs to get married or if I need to get a daughter-in-law, who is going to give a daughter-in-law to a family who stays in a village? And finally, I need money. Yesterday, this was a slide I took from yesterday's presentation that urology practice is no longer cheap. Does a rural patient have the money to spend for your simple surgeries? With a GDP as low as 40,000, they would not be able to afford even a simple TURP. Rural India is no longer there, it is moving. Most of the people from rural India are moving to smaller places, larger places, and with this migration, most of rural India in time to come would be ghost towns. Do they have industries? No, because there are no infrastructures, environmental factors, political instabilities, no connectivities, no industries. So no industries means no money. Yes, we still have one urologist for more than 2.5 lakh population, but this is not important. What is important is what population is needed to keep one urologist happy from the point of view of his survival, excellence, prosperity, and becoming expert in this field. There is no answer to that. So it is possible that in time to come, with more urologists that we are producing, we will have the numbers matching Western population, but probably these numbers may still be concentrated in urban areas and these numbers may not be adequately happy with that practice. How does rural area compare to urban area? The only thing rural areas does better than in urban area is high fertility and high mortality. Obviously, we are not gynecologists, obstetricians, neither we are interested in patients dying. So rural life is heaven for other people, but when it comes to going to heaven, most people will prefer to stay in hell. That is also not necessary. We have 3 good friends. One is a nephrologist in Nagpur, one is a radiologist. So you practice well in the urban area. Whenever you want to take pleasures of rural life, you can always go to smaller places and enjoy life. Sachin, I put this slide only because it's a debate, but I'm sure it's not a debate. Sachin is going to talk about rural urology, but Sachin himself practices in one of the richest cities or municipalities in the country. Let's end by talking about some imaginary things. When I go to a rural India, I feel that the life will be like this. It will be fun, color, lot of music, but in essence, when you reach there, you end up seeing that you are dancing on shreds of glass. So friends, be in an urban place, be in a place where patients chase you rather than you chasing the patient. Stop being a peshab ka doctor, be a proper urologist. Thank you.
Mike. Thank you. Thank you, Pankaj. Very nice talk. Now may I invite Dr. Sachin for practicing in rural area.
Thank you. After such talk, I just have to put only one side. Thank you. Mm. And I just now got that information that my place is the richest place actually. And for that only, uh, I have to make a blazer and shoes that to show up that to show that at least rural doctor can afford blazer and shoes. So thank you to the organizers, MPH and Wisdom QSI. I'm actually not a ardent fan of Bapuji's slogan that Gaon Chalo, but my daughter thinks opposite. She's saying you are because she always says that you have come from Mumbai to Surat to a small place. Uh, for some, it is not by choice, some compulsion. I'm not here to give any points for the debate because there cannot be any one-way conclusion. It's always a individualized and multifactorial plan. Because areas are different and way the rural practice was 10-15 years ago, it has changed drastically. So at some places there may be still a scope for scopes, but at some places the scope is reducing. So blanket conclusion is not applicable for all. I will just put both advantages, pros and cons of a town, three tier or four tier. Actually, my town, from my views, is not a richest. It's a very small town. It's only a taluka place, but it's really rich in super specialist. 10 years ago, there was no super specialist in my town, but now there are 10. Two neurosurgeon, two neurosurgeon, two oncologist, two cardiologist, and there are more visiting, GI, nephro, and all of them. So it is rich. My views are personal, others may have a different. Now, urological healthcare needs in rural India, and still there is a huge gap. Because sometimes people have to travel to Pune and Mumbai, and so the advantage of rural practice is high demand and low competition. It's now relative. At some places, competition is high. At some places, there may not be anyone. So the scarcity of urologists is slowly going down in some areas. So, in rural practice, you can build a strong patient base easily and gradually. Uh, you can have a social impact and you can have a satisfaction socially, personally, and this. So you also get a chance of a direct public health contribution more in a rural place and greater patient appreciation. Patient know by your name, you get name and fame early. So why rural area? This is applicable if you are from a rural area or from a tier 2 city and want to shift to a small place. Because the people who are born and brought up in Mumbai, Pune or a big city like Ahmedabad or Surat, they will not go in a small place. So it has a different factors to choose, like emotional factors, family, social, financial. There is a saturation. There is lots of competition in big places. Uh, Now there were some this glorifying myth about the rural area that there are lots of patients. Yes, it was the case, but few years ago. Now it's a myth. Now number of patients are getting reduced and because even in a small place there are multiple hospitals. Even a small GP or even at my places, it's a trend that every physician has OT. So they build a hospital with a OT. They call you. If you don't go, they call others. So then there is one factor. There is the TINA factor. That is, there is no any alternative. But it is the factor only in some areas now because still, as this nothing sir said that uh, in Nashik, in small places nearby Nashik, there is no this urology. But in our Solapur district, which has two or three big taluka like Pandharpur and Barshi, there are at least two urologists at small places. So it depends on your area. So other factors like fresh air, yes, maybe to some extent still the climate is good. Low cost living, yes, to some extent saves money because you don't have to go for movie or to mall every weekly because there is not much options in a small places, so you can save. No need for blazer, tie or costly shoes. When I went to my place from Surat and Mumbai, for first few days I was using shoes and blazer, tie also. After I saw the patients and they closed, then I stopped using. Now I go to my clinic in a chappal also. So uh, so you don't have to spend. Now important factor is a less travel time. Yes, that is a big advantage. If you are practicing in Mumbai and Pune and if you have to go to operate at a place which is maybe 5 to 10 kilometers, but still you may have to travel for 2 hours. Our places, I go to 30, 40 kilometers and I can reach in half an hour. And now, because of our this GUI planning and the road constructions, roads are really good. Even in a small places, roads are really good. So travel time is reduced. To serve people, yes, uh, less saturation is 10 years ago it was there, but now the situation is changing. Want to do social service, even in Mumbai, Pune, or big city like Ahmedabad, Surat, you can do, but in small place, if you do some social service, you get a name and fame easily, and people recognize you. Now, you also got a chance to do social service by operating patients in Mahatma Phule Yojana, Ayushman Yojana. So, and you also get a number of patients in this scheme because in a small place, many patients they have a Ayushman card. So, uh, if you get a patients in your OP, at least 3 out of 5 operative patient will ask for scheme. So that is a problem also, and that is a advantage also. In a small place, yes, you can have or you can build your own hospital after few years of practice, which is not easily possible in a big place. Relative, friends, network, like in my place, I have so many relatives, so you get a referral. Other factors can live with your parents. If you are from a small place, you get name and fame easily. People in town can give you respect. Uh, Another factor that you can and have to attend functions of your relative friends. When I was in Surat and Mumbai, my friends and relatives were saying that you never came for any of our function. You can have your own plot and bungalow instead of a flat. So another thing is important is reduce personal and operation cost, like lesser staff pay. So if you are practicing in a small place, you can uh, afford staff at a lesser pay. Now this nothing sir has not told us how much is paying for his staff, but still it is less in a small place. So you can have a better work-life that balance in a small place. You can do your practice, you can attend other things also. Now cons, what are the problems? So inadequate hospitals and equipment. Uh, you get a professional isolation, like there are no any peer interaction or conferences and CMEs. There are few opportunities for subspecialty. Uh, Main problem is for your family members because you have a limited educational facilities. At my small place, it's a trend that many of the good rich people or doctors they give their kids at some big place for education. So that is the problem, main problem in a small places. Limited recreational facility. So spouse job opportunities are less. Financial, patients low paying capacity, insurance are less. Now frustration is because of the less charges. Like you have to spend same money for the equipment as people in city, but except for the land, but you get a less in operative charges. So you have to do a lots of freelancing at least in initial practice. Other problem is that you cannot do advanced cases like transplant and robotics or supra major complex cases. Conferences like these are not easily accessible because you have to travel a lot. I have to travel from Barshi to Mumbai, then to here. And another main important low public awareness about the neurosurgeon because people of stone and prostate they go to GP, they go to one MD doctor, they don't know about urologist. Okay, so strategies to overcome the challenges. You can tie up with urban hospital for complex cases, conduct health awareness and screening programs to increase your patient base. Need to achieve equality in top comparison with your urban friends. You have to adapt for long-term perspective to cope up with inadequacy cases. Keep your expectations low. Enjoy the rural life. Thank you.
Okay, thank you, Sachin. That's a nice talk. I just want to give you perspective of what happens. I will give you an example of Association of Surgeons of India, 70-year-old association, can be divided into two eras, pre-Polanyi and post-Polanyi value. Because pre-Polanyi value was open surgery, post-Polanyi value was laparoscopic surgery. So, though he was not the first one to start laparoscopy, he popularized suturing, and the era is divided into two groups. Similarly, I am now for the first time dividing USI era into two groups. Pre-MRD, excellent work, nice teachers. Post-MRD, recognition by world urologists to an Indian urology. That's the contribution of Sir. Everybody agrees with me? And what happened? He shifted from a roaring practice in Ahmedabad city to rural place, and that gave him the world recognition. So, Sachin, you can do fantastic job in rural area. Yeah? Everybody agrees with me? How many of you practice in rural area? How many? That's MRD scientist, right? He says in rural areas. Sanjay Pandey. Everybody should know that he is Amitabh Bachchan's doctor. You know that? So Sanjay Pandey is not. So nice. Do you want to have any comments?
No, I say I used to go to Bashi. I went nearly 15 to 20 years before the first urologist came to Barshi. And every month, 2 or 3 times I used to go. As they said that traveling was good, there are some disadvantages, and I used to operate the whole day, and it was a very satisfying moment for me. And that set up a lot of infrastructure for Pushkar Yadav and himself. And we popularized urology in the peripheral setup. Since he has asked me, one of my aims, so I was in England for 10 years. So my aim was to come back to India. And when I settled in Sholapur, my aim was to see that no open prostate was done in Sholapur district. That was my aim. And I gave a talk about development of urology in Sholapur some time ago. There were no underwater cutting cauteries, so we got from Eclipse. Whereas I went to Barshi and I asked the Eclipse person to bring the cautery machine there. We took the camera, and fortunately, it is not like cardiothoracic or neurosurgery where you need a big setup. Fortunately, for lower tract, even for upper tract, small setups are good enough, and you can carry your instruments. So it is a gradual development. Ultimately, we have to move to periphery. We have to serve our rural people. You know, we can't run away from the realities of life. So, on the whole, it is a great journey to travel. Thank you.
So currently everybody is having West Zone meeting in a rural India right now. So I would like to thank all the speakers and all the moderators for this session.